In the Phase 3 trials for Ocrevus, patients with pre-existing hypogammaglobulinemia were excluded from participation. Patients enrolled were monitored for immunoglobulin levels, and a small proportion of the population developed low immunoglobulin G, IgG, values after treatment without an increased risk of infection. The JCV antibody index, used to stratify PML risk in patients treated with natalizumab, was not studied, and the long-term B-cell suppression on IgG levels and JCV titers is not certain. ACAPELLA is a prospective observational study assessing adverse events in a real-world population. In addition to the collection of infections and other serious adverse events, serum immunoglobulin levels and JCV antibody titer data was obtained on all subjects as part of routine care at baseline and biannually. We sought to evaluate the impact of Ocrevus on immunoglobulin levels and JCV titers and any correlation between IgG levels and infection risk. The ACAPELLA cohort consists of 306 patients. 7 patients that had low IgG values prior to initial treatment remained low at subsequent doses. Of these persistently low patients, only 3 of them reported having at least one infection that required antibiotics. 9 patients in our population developed low IgG values at some point during their treatment. At the time of the data cut, 5 patients only recently developed low IgG levels. All but 1 patient recovered to normal IgG value on a follow-up testing. There was no downward trend in IgG levels seen in our patients. Many of the patients remain within the normal range for IgG value. 11 of our patients showed a decline of JCV index greater than or equal to 0.5 after 1 or 2 years of treatment without an association of decline in IgG. The majority of patients enrolled in ACAPELLA remain within the normal IgG value range at each treatment of Ocrevus, with a small proportion of patients below the lower limit of normal. Of the subset of patients that had low IgG values at baseline and those who developed low IgG values, those that were low at baseline would remain low, but there was no further decline seen. Experience with B-cell depleting agents suggests that long-term B-cell depletion has the potential to lower IgG levels and to increase the risk of infection. This is of relevance in older patients in whom immunosenescence further increases susceptibility to infection. But in our population, low IgG values were not associated with a higher rate of infection. We also did not see further decline in IgG values in our patients that had persistently low values. The drop in JCV index seen in our population was not associated with a decline in IgG levels, though the effect of long-term Ocrevus on JCV index values has yet to be determined.